Hello everyone and welcome back to Medi Notes for Medicos. The topic that we're going to deal today is about rhinoscleroma from ENT nose, and the overview of our topic is we'll be dealing with the etiology, the pathogenesis, clinical features, diagnosis and the treatment. This is going to be a very short topic and a very interesting one, so let's dive into the topic without any further ado. This rhinoscleroma actually is a chronic bacterial infection which is caused by a gram-negative bacilli, which is Klebsiella rhinoscleromatis. Also, it is known as fish bacilli. Okay, so this is very much endemic in the northern part of the northern states of India, and the mode of the spread would be via air droplets. So, what is the pathogenesis? As I said, the infection occurs by air droplets. So, what happens is Klebsiella rhinoscleromatis is inhaled. Okay, the air droplets via the air droplets it enters the respiratory mucosa. And what happens over there is once the entry occurs, the bacteria they go and selectively destroy the mucin producing cells for the growth in the occupied region or the environment. And then what happens? This nose it turns dry. Why? Because mucus production is not going on over there. So once the nose turns dry, and when the current passes through this, because of the normal physiology of our nose, when the air current passes over this, what happens is crusting occurs over there. Crusting occurs and foul smelling purulent discharges seen over there, and because of the crusting we can also see nasal obstruction. So this is the stage 1, also known as atrophic phase or the cataract stage. Okay. Next, what happens is this inflammatory cells like neutrophils, macrophages, etc. they are triggered. So once they're triggered, what happens is once they're triggered, it activates and then it forms necrotic dead tissue of the tissue area of the bacteria and granuloma formation around it. And you can see that infiltration is done by the muculosis cells, and then gradually it causes nodular swelling and masses formation over there. Okay, so this stage is the stage 2, known as the granulomatous stage, and otherwise known as the infiltrative stage. Next is the cicatrization stage, which is the stage 3. What happens over here is, because the if the immune is very good, then what happens? If a granuloma formation is there, then there will be a healing. The healing would lead to further fibrosis and scarring, and later on what happens over there? Stenosis occurs. It can also lead to the narrowing anywhere in the respiratory tract, and it can also cause airway obstructions and deformities formation. Okay, next is the clinical feature. In the clinical feature, this also is based on 3 stages. That is the atrophic stage, we have learned about the granulomatous stage, and the cicatrization stage 2. So in the atrophic stage, what we'll be seeing is we'll be seeing foul smelling purulent discharge and crust. Along with that, we'll be seeing nasal obstruction, and then we'll be also having mild anosmia, that is loss of smell over there. Then in the granulomatous stage, what happens is we see nodule formation over there. Okay, nodule formation. No, these nodules have a particularity over there. The particularity over here is that these nodules have a woody consistency. Okay, because of this woody consistency, it's known as hebranose. If you see over the image over here, let me show you. If you see the nose formation over here, this nose formation is known as the hebranose. Okay, so because of its woody consistency or induration, we can see that it's known as the hebranose. However, the most interesting point of this nodules that you have to remember is it is non-tender, it's painless and non-ulcerative. Okay, where do you see this? Actually, this is usually present in the lower part of the external nose and the lips. Okay, so next is the cicatrization stage, which is also known as the fibrotic stage. So what happens over here is we see the stenosis of the nares and the nasopharynx. Because of this, what happens is the narrowing of the nose occurs, and then tapered nose presentation is seen. You can see over here, this formation of the nose is known as the tapered nose. Okay, next, how do you diagnose this? Okay, so when you diagnose it, first thing, it's a nodule, so you have to go for a biopsy. So histopathology examination or biopsy, you'll be seeing the Russell bodies and muculosis cell. If you can see over here, this is an example of you can see over here the respiratory lining epithelium is given over here with the evidence of squamous metaplasia. And then what you see over here, you will be seeing nucleus cell which has large forming histocytes. Okay, this all are nucleus cells. And then you'll be seeing over here that there is dense chronic inflammatory cell infiltrates, that is comprised of the lymphocytes, plasma cells, and some eosinophils. So what is the culture? For the culture we'll be going for McConkey agar or chocolate agar also can be used. In there you will be seeing pinkish colonies of Klebsiella rhinoscleromatis. You can see over here, you will be seeing like pinkish colonies over here. It can vary from light pink to dark pink. It can be dry and donut shaped too. Okay, so that's how it presents. You can see here it's clearly shown which sort of pinkish um, colonies are formed. The next is the treatment. So how do you treat this patient? The first thing that we have to do is, because it is a bacterial infection, we'll be going for streptomycin or tetracycline. So streptomycin you'll be giving 1 gram per day and tetracycline 2 gram per day. This we will be giving them for 4 to 6 weeks. Okay, when you give for 4 to 6 weeks, what happens is after that when the patient comes again, should you discontinue it? No. Firstly, you'll go for another culture. If the first culture is negative, then you go for a second culture. If both the cultures turn to be negative, then you can discontinue the medication. If either of the one is negative, then you have to again resume the therapy. Next, we have to give them steroids. Why we give them steroids? That is to decrease the speed of the stenosis or the fibrosis occurring. Then we give them 2% acryflamin. Why we give them? If any sort of skin inflammation occurs during this rhinoscleroma, we will be giving this. Now, we already have the nodule formation over there. So what we have to do? A surgery is preferred. Why? To debride the dead tissues. In very rare condition, we can do the irradiation. So that was all for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to our channel. This is Ashna Viraju signing off. We'll be coming with more educating videos. So stay tuned. Bye.